Canadians are flushing COVID data down the toilet. Wastewater analysis is being explored as a new tool to help in the fight against COVID-19, and it's helping track rates of viral infection and community transmission. According to Manitoba Public Health, wastewater analysis being done by the National Microbiology Laboratory suggests COVID-19 viral loads peaked in Winnipeg on January 1st.
There are studies that have shown this wastewater data to be a good early indicator to identify new strains, but also showing increasing or decreasing volumes of transmission.
Really, it's going to be an important tool going into the future, I think, to detect early community spread.
Medical microbiologist Philip Lagasse-Wiens says one of the ways wastewater analysis could help is by indicating increasing infection rates are present before there is a surge on hospitals. That's because COVID-19 can be detected in human waste before the person is symptomatic. Lagasse-Wiens says he would like Manitoba to be more transparent in sharing wastewater testing data with the public.
We need to start thinking, should we be publishing this wastewater testing data and explain to people, you start to see these trends, and that's what is really important, those specific values. And we do see that in other provinces. For example, Saskatchewan and Ontario and BC are all publishing that data.
According to Statistics Canada, the Public Health Agency of Canada has been monitoring levels of SARS-CoV-2, the virus causing COVID-19, in wastewater in Metro Vancouver, Edmonton, Toronto, Montreal, and Halifax since the fall of 2020, and waves of the pandemic look similar between wastewater and clinical case numbers, indicating the level of virus detected in the water followed the imposing and lifting of public health measures in each region.
In the setting of a surge, and we've seen this promulgated in the Boston area, people's behaviors do change.
Dr. Emily Heil is an infectious disease doctor and assistant professor of medicine at Harvard. She says she saw a noticeable change in people's attitudes after wastewater data was published in her area. The data indicated increasing levels of COVID-19 were being detected in the community, which prompted people to wear masks and limit close contacts.
I do think people cut back on their interactions, they improved their masking, and that contributed to the sudden drop that we've seen over the past 10 days, again in the Boston area.
Dr. Heil says COVID wastewater data isn't perfect, and although the science has developed rapidly over the last 2 years, we need to continue refining how the data is used going forward. A spokesperson from the Public Health Agency of Canada's wastewater surveillance says wastewater is allowing us to identify large outbreaks like the recent Omicron wave, but it isn't yet clear if COVID variants like Alpha, Delta, or Omicron are detected similarly in human waste, which may impact mathematical models for case counts. In Winnipeg, Mark Neufeld, City News.